If you want to know about the latest and how we do single dental implants, so watch this video where I can explain to you step by step how it's done on an actual patient. So here we have a situations where the front tooth is broken and it's non-restorable. So the treatment plan is to take it out and put an implant in. So the first thing we do is do a clinical exam, and then we can go ahead and do a digital impression, which will allow us to have a digital file of the patient mouth. We can merge that with the CBCT or the in-office CT scan, which will give us an idea of how much bone we have, if we need to do a bone graft. And from merging both the CT scan and the digital impression, we can make a surgical guide. And also on top of it, we can have our dental technician work on providing us with a temporary that can be delivered at the day of surgery. Most of the time we would like that temporary to be affixed, but in cases where we need to do a lot of bone graft and regeneration, we can make a beautiful device that can be removable, but when it's in, it will be use the other teeth for support, and it would feel like a fix, but it's not a fix. When the implant is placed in the solid bone, then we can do an immediate temporizations on the implant. So the day of surgery, we get the patient numb, we take the tooth out, put the implant in, and then we can go on with the bone graft procedures. We can see right here that we are applying the bone graft substitute, and then we cover it with a protective layer of a membrane that will separate the bone graft from the soft tissue, and it will allow the bone graft to mature. It will become more or less like your own bone, and we go ahead and stitches things back. We give the patient the temporary that they can put on. It's easy in, easy out, but when it's in, it will provide a great aesthetic and help the patient function during the healing time. And this is what it looks like 2 months, 3 months down the road. So step 1 is to do a digital impression for the implant, and then step 2 is start the digital fabrication of the crown, where our technicians will take the crown from the digital library, will start working on it, shaping it, sizing it to match the exact same tooth on the other side. And from there, our conventional procedures will start by making the crown, putting all the colors and the buildups of the ceramic on, and that is the delivering of the crown. The patient is ready to get the final prosthesis, and here we delivered a single crown, and then we see what we did before at the time of implant surgery, and then the final prosthesis on the x-ray. And this is a close-up look of the final crown after the case is complete.
How I feel about it?
Yeah.
Well, right now, it looks really nice. It matches. Yeah.
Okay.
Looks nice. Very nice.